Hi everyone! In this short video, I'm going to explain in a very easy schematic way how I would explain to a student or a first year resident the tunnelization technique when you basically have a very thick tissue above the artery in the fissure and you do not see it directly when you enter the chest. So I outlined some important anatomical structures. You can see the superior vein, the inferior vein, and the bronchi behind it. And then above you can see the lung tissue. We're going to start our dissection between two veins. After, we're going to identify the bronchi, and then in between we're going to see a lymph node. It is very important to continue our dissection above this lymph node. Very gently, we're going to dissect above till we find the artery, because it's going to be there. You just need some patient and gentle dissection. We are going to continue dissecting it and then maybe inserting some machines and cutting basically the parenchyma and opening it in a way that it looks like an open book, let's say. You will see in a second what I mean. So you still can see the veins, you can see the lymph node, and here is the fissure that is opened above the lymph node after identifying the artery and then arterial branches. So this is, I think, the easiest way I would explain someone that is new to thoracic surgery how to do this technique. I think I'm going to add after or in the next video a short version of a real surgery. Thank you!